Great. I have noon, so we're going to go ahead and get started because we have a lot to cover today. Super excited to be here today. Thank you so much for taking time out of your busy days to be here. A couple housekeeping things before we get started. This is being recorded. I have had some technical difficulties with my speaker. So if for some reason there's a glitch or something happens, I'll re-record it and send it out somehow. But that's my hope, that it's going to be recorded to the cloud. So that I've never had this issue before, but it ran into it last night. Another housekeeping, I will send out a PDF of the slides. I will also send an email out afterwards. Feel free to share with anybody on your team. And then I will turn my camera off for the majority of the presentation, just because I do have some videos to play and it's just easier broadband Wi-Fi wise. If you would like to ask questions, please do so either in the chat or the Q&A, whatever works best. I will answer those at the end, just because it's just easier as one person to just kind of go through at the end. And then maybe your question will be answered as we get going. But like I said, I'm super excited to be here today. It's because of our partnership with the Kansas Department of Health and Environment and Kansas Maternal and Child Health that we are here, that we are a stillbirth prevention education campaign and brought to you. We have materials, and this training is for you to know how to talk about stillbirth and stillbirth preventions with your patients or clients. So as we move throughout the presentation today, I think that's really important to keep in mind, is taking back what you learn and trying to insert it into your everyday work. So it becomes one and easy to do this, and so that you remember to do this to save babies in your state from preventable stillbirth. So with that, I'm gonna stop my video and get started. My thing is, I did want to share one quick thing. If you didn't know, the Department of Health has this awesome toolkit where it's this maternal warning signs toolkit, and it has everything from, when to call, contractions, and then we have a count the kicks section in there. So this is completely free too, and I'll make sure this link is sent out in the email that goes out so you have access to it. It's a state-led initiative. And so it's really a goal to educate providers, perinatal persons, family and support persons about the urgent maternal warning signs leading to decreased maternal mortality rates in Kansas. And so I just thought this is always an important piece to share. So like I mentioned, I'm Megan Ockett. I'm the program director with Healthy Birthday. Healthy Birthday Inc. is the nonprofit organization that created Count the Kicks. So think of Healthy Birthday as the umbrella, and Count the Kicks is one of the initiatives so that pulls underneath the umbrella, but it's really our main initiative. And so we are a stillbirth prevention education campaign, and my role within the organization is doing a variety of different things, anything from working on our app, which we'll talk about here in a little bit, to working with our state partners and making sure that the success we've seen in Iowa is replicated in other states so that we can save more babies from preventable stillbirth. I also work on grants for the organization and implementation of those grants. My background is in public health. I've been doing public health for close to 15 years. And I'm just very passionate about maternal and child health. And I especially am passionate about systems level change. So you'll probably hear me talk a little bit about that later on, about including this into your workflow, how easy it is, and again, thinking through those ways that you can do that. So one of the first things I like to do is share a video, and I like to share this video for a couple of reasons. The first being, it's a feel-good video. It's about baby Save Ruby, who was saved when her mom noticed reduced fetal movement after using the app, spoke up to her provider, and they realized baby Ruby needed to be here and got her here safely. I think that also does a really good job. If you're not familiar with Count the Kicks or not too familiar with Count the Kicks, I think it does a good job of kind of giving you that brief overview at just how important fetal movement monitoring is and how to use the app. And then the other reason I like to share it is it really shines a light on the importance of that mom-to-mom storytelling, or storytelling in general. So this aired on Good Morning America in 2017 when baby Ruby was saved. And after it aired, we know of at least 2 more baby saves that we found out about that heard the story that, their parents spoke up and noticed reduced fetal movement and baby got here safely. And then it also skyrocketed our app downloads. So by like 370%. And so we know the power behind these stories. Anytime you have an opportunity to share these stories, if you do home visiting, if you do childbirth ed classes, and you can send these electronically, you can do them in a class, you can share them during family team meetings, because these are powerful and these are what people are going to remember. They're going to, if there's one thing you remember today, you're going to remember baby Ruby, and you're going to know that her mom spoke up because of fetal movement. And so this is slightly delayed, but you should still be able to hear it and everything okay. So I'm going to go ahead and play.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So I just love that little baby stretch at the end there. So when I talk about baby saves throughout the presentation today, what I'm talking about is when somebody contacts us and says, I was using your app, or I knew about Count the Kicks because my provider or home visitor told me about this and spoke up to my provider, and baby had to be born. So that's what I'm talking about when I talk about baby saves a little later on. But backing up, I want to make sure that we're all on the same page of what exactly we're talking about today. And as maternal health workers and in this back profession, I think you know this, but I just like to make sure that we're setting the stage with the same terminology. So today, obviously, we're talking about stillbirth. And stillbirth is the loss of a baby after 20 weeks of pregnancy. And then it's further classified as either early, late, or term. On average, we lose around 23,500 babies every year to stillbirth in the United States. Miscarriage is usually defined as loss of a baby before the 20th week of pregnancy. And then infant mortality is the death of an infant before his or her first birthday. On average, we lose around 22,000 infants every year to infant mortality. So those would be things like SIDS, unsafe sleep, things like that, cancer, car crashes. So the difference here between stillbirth and infant mortality, what I really want you to take away from this slide is the fact that we are losing just as many babies to stillbirth as we are to infant mortality, yet we rarely talk about it. We rarely talk about stillbirth or stillbirth prevention, the way that we talk about back to sleep, safe sleep practices, not smoking around baby. And that's not to underscore all the awesome prevention methods that we have for infant mortality, but it's supposed to shine a light so you can see the difference, to say, if we could be talking about stillbirth prevention and Count the Kicks like we're talking about the importance of laying baby down on back, we could save hundreds of thousands of babies. So today, what I want to give you is the ability to talk about stillbirth and stillbirth prevention with the people that you work with, and to feel comfortable doing so, because I know it can be difficult. So if we look a little bit at the national data, stillbirth's a lot more common than people think. 1 in 169 pregnancies ends in stillbirth, and the racial disparities are huge. For Black women, it's 1 in 96. Black women are 2 times more likely to experience a stillbirth over their white counterpart, friend, or neighbor. Hispanic Latinx moms, it's 1 in 199. Indigenous women, 1 in 138. White moms, 1 in 204. Asian Pacific Islanders, 1 in 233. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. So if we put that in perspective of, we lose 65 babies, around 65 babies a day to stillbirth. 65, that's about a busload of children. That's about a kindergarten class, 65 babies a day to stillbirth. Let's take a little bit closer look at your specific data for Kansas. In 2019, which is the latest rate I have on file, stillbirth data tends to be, depending on the state and how it gets into the system, a year or 2 behind. It's 5.4 per 1,000 live births. If we look at the 5-year average, it's 5.73. Non-Hispanic Black mothers, 11.3 per 1,000. Hispanic, 6.7 per 1,000, and non-Hispanic white, 4.8. So what does that mean? The lives of babies over the same 5-year average, 214 babies on average in Kansas are lost each year. If we implement Count the Kicks like we have implemented it in Iowa, which is what we're doing, that's why we're here today. That's why the Department of Health works so closely with us, is because they want to do this too. If we do what we've done in Iowa, which has seen a 32% reduction in the number of stillbirths, we could potentially save 69 at-risk babies of preventable stillbirth with our campaign. And so while I talk about that 32% reduction, this is in a graph form. So to kind of give you some background, in 2008, Count the Kicks was created. So kick counting has been around for a long time, but the tools and resources for providers and those that work with expectant parents to easily talk about stillbirth and stillbirth prevention was created by Count the Kicks in 2008, as well as the tools and resources for expectant parents to understand the importance of tracking fetal movement in the 3rd trimester. So in 2008, we had this soft launch, and I'll go into a little bit more of the history here coming up of how it was founded. But what you can see here, what I want to point out, from 2008 to 2018, we saw a 32% reduction in the number of stillbirths in Iowa. In the first 5 years of the campaign, we saw about a 39% reduction in the number of stillbirths among Black African-American women. And then if you see, we have preliminary data for 2021, which is 4.1 fetal deaths per 1,000 live births. So we're still around that 3.9, which is our lowest on record. There are a couple years, you can see it shot up there in 2019, it looks like, and 2017. There's a lot of variability there. It could be something like a syphilis outbreak or a pandemic. We don't have that type of information, but the important thing to know is that the trend line is going down, and it's going down significantly. And public health officials have said there's nothing else going on in Iowa that would have made such a dramatic impact on the stillbirth rate. There's not like every pregnant person got a doula, which would be amazing. And we know that would decrease stillbirth rate, among other things. It's not like smoking decreased or obesity. In fact, those actually have increased in Iowa. All of those are risk factors to stillbirth. And so we're excited to bring this sort of replication to Kansas, but we need you to help us with it. So I just want to take a moment to focus, and I think it's really important to focus on why are there such racial disparities. So researchers point to the following as causes to some of these disparities. And I don't think any of this will be surprising, but what I do want you to do is think through what can you do in your organization to impact and so make it so that race is no longer a predictor of stillbirth. That's our goal. So things like systemic racism and then toxic stress. Research shows that years of being treated unequally and or unfairly Essentially, being an African-American woman in a systemically unjust society has led to real and pervasive health issues for Black women. Epigenetics, those variations that are caused by external or environmental factors, changing how cells are read, predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, high blood pressure, that is all linked to maternal stress. And experts say Black women are less likely than other races to receive early treatment for these conditions, access to healthcare, socioeconomic barriers. But research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. So what is Count the Kicks doing to reduce disparities in stillbirth outcomes? We have a health equity coordinator on staff. We're continually looking for funding opportunities to reduce racial disparities that persist and exist in stillbirth. We are an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We're always looking to improve our programming based on lived experiences shared by people of color. We're working within communities considered to be marginalized. We work outside typical healthcare settings. We have programs that work with dental clinics and beauty salons and churches. We have an app in 14 languages. It's completely free. We have culturally appropriate educational material. We have videos and lots of different things translated into multiple languages. So just to give you a little bit more background on really showcase how truly this is an evidence-based backed campaign. And this is the research study that started it all. So if you're really not into research and you're just like, oh, I don't want to read anything, that's totally fine. I understand. But I highly recommend if you read just one, it's the study that you see on your screen. And we have this in our evidence page on our website. And the reason I want you to read it is because one, it's short, but two, it is the research study that created us. It started it all. And so when I talked about how we were founded, what I want to say and tell you is that we were founded by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. And at the time of their loss, they actually did not know each other. They were not connected until after their loss and got connected through friends and pastors. And as they started meeting and kind of grieving together and talking over coffee and saying, why did this happen? And why didn't anybody tell us this was, more common than people thought? Because that's what they were told. They were told this is not common. I think some were even told like, this is like getting struck by lightning, and that's not the case at all. You're more likely to have a stillbirth than to get struck by lightning. And so as they were grieving, one of the first things they did was we, decided we want to make sure nobody joins our club, right? So long story short, what they ended up doing, they were at a public health conference speaking about a stillbirth registry that they created with CDC funding in Iowa. And at this conference, they heard some researchers out of Norway talk, and Dr. Ruth Fretz, who you see on your screen, she was one of those researchers out of Norway, and she was telling about a study that they had done that showed when expectant parents were educated in the 3rd trimester of pregnancy on the importance of tracking fetal movement, that the stillbirth rate among this cohort decreased around 30%, just by educating about the importance of tracking fetal movement and speaking up if they notice a change in that fetal movement. And so the women hearing this said, this is it. This is what we need to do. We need to bring this back to Iowa. Great things happen in Iowa. Great things start in Iowa. And that's what they did. They came back to Iowa. They worked with Iowa Department of Public Health. They sought out other literature and research behind the evidence of kit counting, and worked with Strategic America, a local marketing company, to create an empowering, brightly colored campaign. Because like I said, nobody wants to talk about stillbirth, and it's sad. They know it better than most people, having experienced it themselves. So what they wanted to do was create something that would be empowering, that would provide people with tools and resources to talk about this, and to talk about it in a way that is empowering and impactful. And so Dr. Ruth Fretz had said, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. And so you're going to hear me a couple times really emphasize the word normal, and I'll get to that in a minute, but that's what I want you to pay attention to. We were also named a best practice by the Association of Maternal Child Health Programs. They do a whole scientific review. They're the leading maternal health association in the US. And if you've heard about the Hear Her campaign from CDC, they listed babies' movements stopping or slowing down during pregnancy as one of the urgent warning signs for pregnant women. We've also been at several conferences, the Society of Maternal and Fetal Medicine, talking through some of our own research that we've done. And then I think a common concern that people might have is, oh my gosh, I can't do this. This is just gonna like make everybody anxious. They're all gonna come in, they're gonna flood my clinic with calls. And I'm here to tell you that doesn't happen. Here's a great quote from a research study. Again, go to our evidence page, but they say, one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or inpatient. However, most research has not found this type of increase to be true. Usually the fetal movement count is reassuring to the pregnant woman and prevents unnecessary visits. We have done our own study on our app users app users from the last couple of years with the Des Moines University and the Harkin Institute. And some of their findings were that 84% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. Researchers also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. Because if you think about it, what our app does and what our program does is it gives knowledge to expectant parents. It gives them data in their hands. It's sort of like that data download for their gut, their intuition, to be able to go to a provider and say, this is not my baby's normal, right? This is my baby's normal. Look at this chart, look at this graph. That's what it does. And so you have highly educated individuals now who understand how and why to count kicks, and are ready to go in if they feel like that has changed. There's no guesswork around it. There's also added benefits that I don't think people think about. This can help, it's really a check-in with baby is fetal movement monitoring. It's not like you notice reduced fetal movement and you go in and baby's delivered right away. I think people always go to that conclusion, and that's not necessarily the case. They might go in and they might find out that there's something else going on that needs to be looked into. Maybe fetal growth restrictions are identified earlier. Maybe in the case like of our executive director who went in and she was having contractions at 30 weeks and they were able to stop contractions. She was able to have a healthy baby boy at 40 weeks. I think it's also important to note that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. There was a study out of California that showed women were 4 times more likely to die if they had a stillbirth. So if we can prevent preventable stillbirths from happening, we can potentially save mom too. And so I love this quote from this researcher that says, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. And remember, if you have questions as we go, feel free to put them in the chat or the Q&A, and I will answer them at the end. So additional research articles here, you can go to our evidence page on our website and see that all of that research if you like reading that stuff. Okay, so why are you here? You want to know how to implement this, right? Obviously, you already know this is a stillbirth prevention public health campaign. Again, it's evidence-based. We are educating birthing people on the importance of tracking fetal movement, either through the use of our mobile app, which I'll talk about here in a moment, or we have paper charts in 3 languages. You are empowering birthing people to speak up to providers if there's a concern. So, but why do movements matter? Movement is one very important way a baby communicates before birth. A change in a baby's movements can be an early sign and sometimes the only warning sign that a baby may give when in distress. So why do they change when they're in distress? If you think about it, they're just like us. When you and I are not feeling well, we just want to sit around on the couch. We don't want to do much. We're conserving that energy, right? Same thing with babies. If something's going on with baby in utero, whether it's low amniotic fluid, infection, whatever it is, cord, their movements are going to change. They're going to either become weaker, they're going to become less, when they're not feeling well, that's what they're going to do. They're going to slow down, so I think it's important to know that they're just like us. Something's going on. We need to get checked out. So there's really 3 types of movements change I want to highlight here. There's baby has fewer or no movements and they slow down, or baby may move, but movements are softer or weaker. So the strength has changed, which you heard baby Ruby's mom say earlier, that her movements just felt softer and weaker, as well as, slow down. But then there's a third one that I think it's important to be aware of, and that's that sudden wild surge of movement. That can really be an important sign. And I'm talking not like normal strong. This would be acute to like a very aggressive movement, almost like babies struggling, for lack of a better word. So just the important thing to know when you're talking to patients is what you want them to know is that it's important to track fetal movement so they understand what's normal for their baby. So then they can easily see visually and know when something seems off and their movement has changed. So when should you start doing this? I want you to start talking to patients or clients about this at 28 weeks. So that's right at the beginning of the 3rd trimester, or 26 weeks if they're considered high risk. And so this is when research has shown that baby has established a more consistent pattern that mom can really feel and track. So when you're talking to them, they might say, what does that mean? What is a kick? It could be a roll, it could be a kick, it could be jab, it can be anything but hiccups, any sort of movement, except hiccups, because hiccups are involuntary, so they do not count towards this. And then this is just a great graphic to show you that you could show with expectant parents, how Count the Kicks can help you be in tune with your baby. So we want them to track their baby's movements with the free app or a paper chart on our website. You want them, and you want to tell them this, you want them to count daily, preferably around the same time every day. And they're going to time how long it takes baby to get to 10 movements. And I'll go through that here in a minute. And then after a few days, they should really be able to see, especially using the app, the pattern, the trend, how long it's taking baby to get to 10 movements. They'll be able to visually see that. And then they continue tracking daily and calling their provider right away if they notice a change and how long it takes baby to get to 10 movements, the strength of those baby's movements, or any significant change. So I'm going to do like a speaker, know that we shouldn't do, but I'm going to ask you to multitask. I'm going to ask you to pull out your cell phones if you're able, to go to your app store, whether it's the Google Play Store or the iPhone Apple Store. And I want you to do this because I want you to search for Count the Kicks in the store, and I want you to download the app. I want you to see how easy it is to use, and I want you to be able to share it with your clients and your patients. I would love for you to be able to pull out your phone when you're talking to them and say, look how easy this is. Let's set this up. You're ready to start counting. Let's go ahead and set this up on your phone. So take a moment and do that while I'm talking and you're listening. And I know we can all multitask because we've been in a pandemic for 2 years, and that's just the nature of how things have progressed. So as you're doing that, this is how you use the app. It's in 14 languages, and you can see those on your screen. It's available on Apple and Android products and the Apple Watch. Users can restart their session or delete a kick. So if you're not that familiar with the app, what you do is you download it, and it's going to walk you through like how it works, a couple slides of how to use it. And when mom is ready to start counting and she hits that little red, well, it's actually a big red button that says start counting, you're going to see that screen there with the footprint. And when mom wants to start, she'll feel that first movement that she wants to start with. She taps that footprint as soon as she feels that movement, and a timer will start. So every time she feels a movement while she's sitting there and focusing on baby, she taps the footprint until she gets to 10. After she gets to 10, the screen will change, and it will show her what you see behind that screen. That footprint screen is a graph. And what this graph does is it gives the user a visual representation of how baby has been moving. So for example, this baby gets about 10 movements in around 15, 16 minutes. So the average amount of time it takes this baby to get to 10 movements is 15 minutes. So if one day I'm counting and all of a sudden, I don't know, it took an hour and 20 minutes, you're going to see that graph visually change. You're going to see that line shoot up. So it's going to be that visual change that's going to notify mom and say, oh, that's not my baby's normal. My baby's normal is around 15, 16, 17 minutes. That's a significant change. I'm going to contact my provider. And that's it. That's how simple it is to do. There's other great features on it. You can set daily reminders. You can, and I think that's really important because they don't have to go out into their own calendar. It's all within the app. So then they'll get notifications of when it's time to count of whatever they set up. So it'll be like nice little notifications like, hey, it's time to count your little kicker and things like that. You can review kick counting history. One really important component, especially during the last 2 years of a pandemic, where we know appointments have gotten stretched out or they're virtual. You can download history. They can download their chart in Excel form and send it to their provider. They can bring it to their next appointment. This is key when we're bridging that gap between like telehealth and virtual appointments and things like that. You can count for singles or twins. You can track future pregnancies on the same profile. So I have 3 children. My last was born in 2018. So if I were to get pregnant again, I could just log in to the same account I used in 2018 and set up a new pregnancy profile. And then I also have my son's data too, because I used it in 2018. You can manage multiple devices. So I could be counting on my iPad one day and then it syncs automatically to my phone the next, or even better, this is a way to include significant others. They can sign up, they can go into your account on their own device and see how baby's been moving. It's a great way to bond and include others. And then, like I said, it's available on smartwatches as well, on the Apple smartwatch, I should say. Now, I just want to spend a couple minutes talking about our newest feature of the app. You've heard me say this quite a bit throughout the presentation so far, is it's also important to understand and know the strength in those babies' movements. So last July, working with researchers and medical providers, we decided to add a strength tracking feature to our app and a notes feature. So how this works, so if you remember on the screen, you were tapping that footprint, you were getting to 10 movements. Before you finish and before you see that graph, you're going to see that second screen, that second image where it says almost done. Please fill out the following fields to finalize your kick session. So we counted movements. Now we're going to track. Now we're going to say what the strength of those movements were. So in that session, in that session we just had, how strong did baby feel? And so they have an option between choosing basically 1 through 5, 1 being fluttery, all the way to 5, which would be fierce. So they just tap the footprints and it automatically fills them in depending on what movement they wanted. And so this is a great way to, again, see how baby's been moving. Because if we think back to baby Ruby's story, where her mom said her movements just felt weaker and softer, it's also important to pay attention to that. So then after they do that, they get a bar graph. They get a bar graph that shows them daily, like how baby's strength was, and then the average movement strength you can see by the feet. So then at the very end, you can see that graph on the far right that says, if you look at that one, for example, the movements took significantly longer. I can tell that because the line shot straight up at the end, and also the movement strength decreased. I'm not saying that these two have to complement each other at all. This is just obviously for an example. But I'm saying that's quite a significant change, and you can visually see that. So if I were that individual, I would call my provider and see what they want me to do, because then it's them and the care team to say, okay, we need you to come in and get checked out and make sure baby's doing okay. And then they just hit finish session and that's it. That's all they do. And then there's that note section so they can put reminders in there too. Another cool feature that we just added was the ability to watch videos. Not all of our videos are on here, but several key ones. So if you are working with families and you have an opportunity to, download the app with them and set them up, take some time to look at some of these videos. These are kind of the how-tos, why it's important. They're not long, so it would be really great to just include them in your session when you're going through, and then they can view it at any time as well. And then this one is really exciting because our partnership with the Kansas Department of Health, one thing I think it's really important to know is we want to make sure that we can provide care to anybody that needs it prenatally, so that somebody who's pregnant does not have to wait for her 6-week appointment to, find help if she needs some therapy, or maybe they're trying to find food assistance or whatever it may be that they might need to find resources for. If we can connect them to resources prenatally before they have a newborn at home and life is going a million miles a minute, they have a newborn and their milk is coming in and it's crazy, it's stressful. Before that happens, can we connect people prenatally to resources? And that's exactly what the Department of Health is doing. So there is a survey now on the app for all Kansas users, and this is specific to Kansas. We worked with the health department to come up with 4 or 5 questions, all geared towards making sure that people felt like they knew how to access resources should they need them. So there's simple yes or no questions that happen after the second kick session. People are asked a series of questions, and then at the very end, it says that middle screen where it says, if you answered no to any of these questions, 1-800-CHILDREN can connect you to resources in your area. Click Find Support now or visit the resources section of the app. So Find Support, automatically calls out to that 1-800-CHILDREN. How amazing is that? You are connecting people directly to resources as they need them. And so this is just truly an amazing resource. Iowa implemented something similar that sends people to a directory, and then Kansas, I'm super pumped to see, has also done that. We also have another way to get free or reduced cost resources. This is on our website. This is on the app as well. You can just enter your zip code and find free or reduced cost resources. Maybe you need housing assistance and things like that. So that's open for everybody as well. And then really quickly, I have a short video of how to use the app and how easy it is. So let's watch.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So yeah, super simple and easy to watch that. So now let's talk about, about the app, you downloaded it because you were multitasking. Let's go into how you truly do implement this. We have about 15 minutes left, so we're gonna run through this. I think it's really important that before we dive into how to talk about Count the Kicks with patients and clients, I want to spend just a moment to share how what we're doing today is giving you the tools to not just talk about stillbirth prevention, but also providing health literacy to your patients and clients. By doing these 5 things, when you talk to your patients and clients, you're automatically increasing their health literacy. So things like being equitable, avoiding assumptions, and provide all expectant parents, no matter their race, gender, religion, socioeconomic status, sexual orientation, marital status, or education level, the same information and interaction. Listening, learning, asking strategic and open-ended questions. I'll talk about that in a minute. Be clear and concise, avoid medical terminology, consider everyday vocabulary. Being honest, speak the truth while still practicing empathy. I'm telling you, we can talk about stillbirth and stillbirth prevention with expectant parents, and we have to move away from this thought that it's taboo to do. And then reteach. If the patient displays confusion or lack of understanding, make sure to correct and clarify, providing extra support to those who need it. So thinking through like, oh my gosh, I don't want to scare people. We've talked about this. And I think it's really important to know that pregnancy is full of risks. You all know this. We talk about this all the time. We talk about not drinking while pregnant because of fetal infant, death syndrome, and taking a vitamin and not smoking. We do that all the time. We've done the blood tests. If you've been pregnant, you can do all of those. So why are we not talking about this? Stillbirth is another risk that expectant parents deserve to be educated about. Or maybe you're thinking stillbirth just happens, there's nothing we can do. You're here today, that's not true. So there can be warning signs if moms know what to look for. Her baby's always active. You're going to get this pushback a lot, probably from your patients or clients. Oh, I don't need to do that. It's like a jungle gym in there. And I'm always like, my response is always like, that's amazing, healthy babies and active babies. But it's still really important to count your kicks so if your normally active baby has changed, because cord and placental accidents can be sudden, and you need to know what's normal for your baby so you can easily notice that change. And here's kind of an old wives' tale, it's fine because she's almost at her due date or past her due date. The risk of stillbirth actually increases quite a bit as a mom approaches or exceeds her due date. What about talking to people who have had a stillbirth previously about fetal movement? You'd follow the exact same protocol. Although since women who have stillbirth are more likely to experience another one, let's start doing that around 26 weeks. Feel free to talk about the previous stillbirth, acknowledge her child, especially if you were not her provider before or knew about it, asking about the name, the gender, obviously staying away from medical terms like fetal demise, of course, being empathetic. And then ask if anybody's talked to them about the importance of tracking fetal movement. A lot of people we talk to, a lot of our ambassadors who are in fact lost moms say, I had 2 healthy, perfect live births. Not once did somebody tell me I should be doing this. And why didn't I know? I should have been doing this with every single pregnancy. Everybody should be told this. And we want to turn that why didn't I know to I'm so glad you told me. And that's what you're going to do. That's why you're here today. So again, 28 weeks or 26 weeks otherwise, and then really using those open-ended questions. Telling me about how to track, or tell me what you know about the importance of tracking your baby's movements. Let's talk about how to track your baby's movements. You want them to count each day, preferably around the same time. It's all about learning baby's normal and speaking up if they notice a change. If I have any clinicians in here today or anybody that works in a clinic office, I don't know, in Iowa, we have to do a glucose test in the office where we drink that wonderful sugary drink, and then they take our blood and we sit there for an hour, and then they take our blood again for that first one. That's a great opportunity to say, hey, while you're sitting there waiting for your next blood draw, read this brochure, download the app, and then we'll talk about it. So be thinking about that. How can you be talking about this in your workflow? Here's that active one again. We've already talked about it, but it's important to do again, because I guarantee you're going to get asked this. Count the Kicks gives them real data to show their healthcare provider if they have a concern. This is a common one. People think I should just be doing this with high-risk people and only those at high risk. And I think it's really important that we do not just do the glucose test for those that are high risk for gestational diabetes. It's the same for this. Everybody should know about this. They should all know about the importance of tracking fetal movement in the 3rd trimester. Ooh, a more common one. 10 and 2, I guarantee you have all heard this or thought this is what people should say. I should get 10 kicks in every 2 hours. And so I think what we need to know and share is that current research indicates Moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements. This is outdated, 10 kicks in 2 hours. We have, again, if you're into research, we have a research study on that on our website you can read about as well. Doppler device, again, a change of the baby's heartbeat is one of the last things to occur when a baby's in distress. I know there's apps down there that you can download. Really, unless you're medically trained, you should not be using the Doppler device. It's just like if you go in with reduced fetal movement, the clinician will not and should not be only using a Doppler device to make sure baby's okay. There's other tests that they perform. Some other common myths. This is also a very common one that you'll probably hear a lot, or you have even thought. If baby's not moving or not moving like normal, go ahead and drink cold water or juice or eat something sugary. And I've even heard jump around. Research has moved away from the idea that sugary drinks and other things like that are a good way to get baby moved, because kick counts are best monitored without interventions. Again, when you and I are sick, we're not trying to drink a bunch of Mountain Dew to get going because we're so tired. So why are we trying to force baby to move if baby's not moving like normal? Babies kick less than near the end of pregnancy. Again, they just move differently. The types of movements may change, but they should still be able to get their 10 kicks at the same amount of time. And then if I have any dentists in here or hygienists, again, we want to stress that good dental health is always important. Pregnancy can increase expectant parents' risk for dental issues and overall health issues. And labor and delivery is the perfect place. If you're in a coalition and you have nurses there, you can order this material and you can have this for them to use at any time. You can send it to them, they can order it. So absolutely. So again, really important about systems change. Could you use a form at check-in? Could you have your front desk staff trained and have them fill out, or read a brochure? Again, that glucose, or if you're a family, if you're WIC or home visiting, is there an intake form you could have them fill out? Here's my favorite. If you work in labor and delivery, we have a gold standard after visit summary. It's easy, it's there. I go in to triage and I get sent home because everything looks good. Baby's checked out good, I've checked out good, and here's what I should be watching. Let's include this in any sort of documentation that you all have, that you can easily do this. Here's just another example of a coalition in Ohio and how they integrated Count the Kick. So I'm happy to talk with you more about this if you want to integrate this into your setting. It's super easy to do. We just need to know your system, and then I can offer some ideas. So we have a lot of sample material on our website and everything like that. So now really other fun part, I'm going to ask you to do something also a little unusual for a presentation. We have, thanks to our partnership, my QR code went over that, but thanks to our partnership with Kansas Department of Health, you can get all of this material for free. So you can get this how-to poster that you see on your screen. You can get brochures. You can get the magnet. That's a picture of the magnet to hand out to moms. The magnets are $25 per order, but you can get brochures and it's free. So now what I'm going to do is I'm going to play this awesome song for about a minute or two because we don't have much time left. And I am asking you to go place an order right now. And I want you to go to countthekicks.org, fill your shopping cart, click on Kansas, fill your shopping cart and order it, and then come back to me. Don't go away. It's not over yet. But if you order during the presentation, what I'll do is I'll look at the registration and the orders, and you'll be entered to win a $25 gift card to Amazon. So I'm going to play and give you just a minute or two to place your order, and go. I'll just jump forward to the music if I can. Oh, it's not going to let me. It's coming, I promise. But go ahead and order.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because
right. I know that was short and sweet, but we still have a couple of things to go through. There we go. You also have access to an online CE training. So keep ordering if you do, but multitask. And I know we're good at that. You have an online CE training, and I'll put this all in an email. So you don't need to like quickly write down this link. But again, thanks to our awesome partnership with Kansas Department of Health, you can take a 90-minute training for free and get credit for it. You just use that coupon, Save Babies-KS for Kansas, and you do have to write it exactly like that to get it. But again, you get it for free. So along with our free materials, you also get free digital resources. We have a parent academy, provider academy, kick counting charts, lots of different options. And then we also have amazing, amazing ambassadors. And you are lucky, you have two amazing women who are passionate about Count the Kicks, Sapphire and Deanna, both with passion and different backgrounds. Sapphire lost her baby girl to stillbirth, and Deanna saved her baby girl due to knowing about Count the Kicks because Sapphire worked and brought it here, and Kansas Department of Health brought us here. So we're just so fortunate for them to be in our lives, and that they are just as passionate about this as we are, and as the Department of Health is. They can do in-person meetings, they can do media interviews, anything that you might need to. As much as I'd love to visit you all in Kansas, I can't usually just hop on over and get there in time. So they are available too, and they're just volunteers. So we'll do that. And then baby Eva there, I do want to end on a very, very high note on baby Eva's story. And I have her video. These are just some of the baby saves. But this specific one, here is Eva. She was saved, I think about 1.5 years, 2 years ago in Kansas. And here is her story.
I feel like it's what saved my baby. It was at my doctor's appointment. I think I was about 28 weeks when they gave me a brochure from over there. That's when I downloaded the app. And then it became a part of like bonding time because I would like set aside an hour every day and then count the movement. Another thing is that it tracked all the data, so it was a way to know exactly how long it took. It was interesting to actually see how long it took because the app, you can tell how long it takes and then you can just tap it. It was pretty easy to use. Towards the end of my 36th week, it started taking longer than it usually did. I didn't want to go to the hospital if I didn't have to. And then they found out I actually didn't have any, I got really low fluids. It could have been a different outcome altogether. My provider was listening. They took my concern pretty seriously, so that helped too. So I encourage them to speak up because their baby lives might depend on it. The app just tracks the time, so it's pretty easy and it's free to download. So yeah, definitely encourage other people to download the app. Right now, she sleeps a lot, she eats a lot, but she's a happy baby. I'm really grateful that I found out about Count the Kick from my doctors.
Baby Eva, so cute. All right, so that's it. Next steps, you downloaded the app because you did that while you were talking to me or listening to me, I guess. You ordered the material, so you're good there. Know that this takes 3 to 5 minutes. Make sure everybody in your team knows about this. Use EHRs, talk to me if you have a way or want to talk through how you can easily integrate this. And really remember, hours and minutes matter to preventing stillbirth. And so if somebody has a 30, 45-minute drive, you need to let them know that they shouldn't be waiting around for a call back. If they notice something's changed, they need to contact their provider right away. Follow us on social media, reshare our posts, because that's going to reach more expectant parents in your area. Sign up for our newsletter so you're always in the know. And then it's because of you all that we're saving babies together. It's not me sitting here in Iowa. It's you taking what you learned today and going out and sharing this with your clients and patients. And then you'll get those baby safe stories just like Eva, and that will be amazing. And so I can't thank you enough for spending an hour over your lunch hour with me. I'm happy to answer any questions. You can email me. I love hearing from you. And of course, thanks again to the Kansas Department of Health and Environment. It's amazing what, we're better together. So I'm so excited to be in Kansas. And like I said, happy to answer any questions. I'll just take a look at the chat to see if anybody has. Otherwise, like I said, this is being recorded. So yeah, let's see here. So somebody had asked, so what is it that happens to Blacks that are Black women? They are not having the same outcomes, just doctors and nurses are not listening to them. Vicki, that's a great question. And I think that, the racial disparities are large. And I think it goes back to that slide where there's a lot happening, right? The systemic racism in particular, that toxic stress too. So I think that's why when I mentioned thinking through too, what else we can do as your own organization, how else we can address those racial disparities that exist and persist, I think are really important. And this is one way of recognizing it and knowing that we need to be sharing this information so that everybody's aware. And it also goes back to that health literacy too, and making sure that we're treating everybody the same no matter what. I think that's really important. Nepali language that has been requested. We will certainly look at that. Languages are just dependent on the area you serve to, and then funding. So we'll reach out to that. Any idea if when this program will come to Missouri? Hey, I don't know who asked that, Melissa. We are in Missouri, actually. So you can go to countthekicks.org and click on order materials and click on Missouri and you can order materials. So absolutely, we are in Missouri for free. Just ordered mine today. Awesome. You received your order today or order already, Stacy. Is the app recommended over the bands? So what this person's referring to is a pilot project that we started just this year, actually just about a month ago with the Kansas Department of Health, where we sent out toolkits to home visitors from a list that we received from the state that included wristbands that you can order online now as well. But these wristbands have the numbers 1 through 10 on them, and then like a little slider. So I would really recommend using these wristbands if you work with a population that maybe doesn't have like very rural, where there might be Wi-Fi or broadband issues. So the app maybe is harder to use, or maybe it's easier to use the band because of a language barrier. So really think through how to use the bands. I would say the app is I don't want to say better, but it's just, it gives you more of that chart, that data than counting on paper with this. But the wristband is really nice to have, especially working with those individuals that, like I said, maybe have Wi-Fi where the app doesn't always sync and things like that. I think the most important message is that you're teaching them how to do it and that you're recommending they do it daily, and then keeping track of that and speaking up if they notice a change. So I hope that answers your question. Bands and magnets are available too for Kansas specifically. But again, I would highly recommend using the bands with those types of populations. Let's see. Oh, Jill already answered that. Sorry, Jill. Jill is my partner in crime. So she is with the state health department too. I don't know, Jill, if you're certainly, I can unmute you too, Jill, but are the slides from this training available to participants? Yes, I will send out the PDF of the slides as well as the recording, I hope. And yeah, and links to all the stuff that I referenced. So Jill, I will unmute you. I'm sorry, I didn't realize you were on earlier. So Jill, you have access to unmute if you want. PDFs. Yep, I'll send PDFs. Hey, Jill.
Hi, everyone. Thank you so much for attending today.
Yes, thank you. Thank you. I'm going to stay on for a couple more minutes. If you guys have questions, I'm happy to answer them. Stacy, I love that you've had great feedback on the wristbands. Feel free to email me that, because we could use that as a testimonial, as a quote. I think that Jill and her team would love to know that too, because it was a pilot. So my contact information is on the screen. I'm just making sure I didn't miss anything. And it looks like, Jill, you rocked it and answered several. So, all right. So yeah.
Thanks so much, Megan, for everything you do.
Thank you. Thanks for bringing us to Kansas. It's exciting. Thanks all. I hope you all have a great warmer day than me. So we're at 37 now. I'm gonna stop recording. Thanks everybody.